Chili cook-off on being.
Peg Morrison still remembers the heaviness of dealing with anxiety and depression while she was in grad school.
It's rough. It's dark. There's no way to describe the rabbit hole that I fell down, and the hopelessness, the sort of just expanding anxiety.
It's what led Morrison to her job with NAMI North Carolina. She now uses her lived experiences to give insight to the people she serves.
Mental illness is inherently isolating. You don't want to be around people. You feel misunderstood. Throw in a pandemic and you're not supposed to leave your home, it adds a whole new level of anxiety, especially folks with health-centered, anxious thoughts. It made everything deeper and more difficult.
Experts say the pandemic revealed systematic challenges around access to care, especially for children. Prior to the pandemic, there was a shortage of mental health clinicians for adolescents, inpatient beds, and access to services.
The increased population, the worsening prevalence, and the lack of investment in services has led to the perfect storm where we find ourselves now. Throw a pandemic into the mix, and so everything that was already bad got worse.
It's one of the reasons why North Carolina is creating additional resources to support the new mental health crisis hotline rollout in July. The ease of remembering 988 compared to the current 11-digit hotline is expected to increase call volume by up to 30%. Callers will be put in touch with a trained crisis counselor who will help de-escalate the situation.
And I think because so many people are hurting now, it's helping to overcome stigma. It's helping to make this something that's all of our problem. And I think that is generating a broad-based support. So I'm encouraged to see in many states across the country a huge investment in mental health that we haven't seen in decades.
Morrison is also encouraged by the conversations that are now taking place about the importance of mental health.
I can think of an example. At a NAMI class, I told my story, and one of the women, she knew me as a NAMI person, a professional, and she said, "You really get it." And I said, "Yeah, I get it. I lived it." But it lifts them up. It gives them hope, and that's very humbling and redeeming for me, too.